Which type of shock is most likely to present with jugular venous distension, JVD? A. Hypovolemic shock. B. Cardiogenic shock. C. Obstructive shock. D. B and C. E. All of the above. Answer: D, B and C. A patient with liver cirrhosis develops shock after a large volume paracentesis. What's the primary mechanism? A. Hypovolemia from fluid removal. B. Cardiogenic from cirrhotic cardiomyopathy. C. Distributive from altered vasoreactivity. D. Obstructive from large volume ascites. E. Septic from spontaneous bacterial peritonitis. Answer: C. Distributive from altered vasoreactivity. A patient with severe pancreatitis develops shock. Which mechanism is most likely responsible? A. Hypovolemia from vomiting. B. Cardiogenic from toxic myocarditis. C. Distributive from inflammatory mediators. D. Obstructive from pancreatic edema. E. Hypovolemia from third spacing. Answer: E. Hypovolemia from third spacing. Which physiologic change would you expect in both septic and anaphylactic shock? A. Increased cardiac output, early. B. Decreased systemic vascular resistance. C. Elevated troponin levels. D. A and B. E. All of the above. Answer: D, A and B. A patient on dialysis develops shock during their session. What's the most likely mechanism? A. Septic shock from catheter infection. B. Cardiogenic shock from electrolyte shifts. C. Hypovolemic shock from ultrafiltration. D. Distributive shock from dialyzer reaction. E. Obstructive shock from air embolism. Answer: C. Hypovolemic shock from ultrafiltration. In which type of shock would you most likely see a widened pulse pressure? A. Hypovolemic shock. B. Cardiogenic shock. C. Early septic shock. D. Late septic shock. E. Obstructive shock. Answer: C. Early septic shock. A patient with Addison's disease presents in shock. What's the primary physiologic mechanism? A. Hypovolemia from salt wasting. B. Distributive from lost vascular tone. C. Cardiogenic from lack of ionotropic support. D. A and B. E. All of the above. Answer: D, A and B. After a massive transfusion, a trauma patient develops shock with hypocalcemia and hypothermia. What's happening? A. Hypovolemic shock persisting. B. Obstructive shock from clot formation. C. Cardiogenic shock from electrolyte abnormalities. D. Distributive shock from transfusion reaction. E. Mixed shock including citrate toxicity. Answer: E. Mixed shock including citrate toxicity. A patient with pheochromocytoma develops shock after tumor manipulation. What's the likely progression? A. Hypovolemic. Distributive. B. Distributive. Hypovolemic. C. Obstructive. Cardiogenic. D. Cardiogenic. Distributive. E. Hypovolemic. Cardiogenic. A. Swir. B. Distributive. Hypovolemic. A patient in septic shock isn't responding well to fluids and norepinephrine. Adding which hormone might help by addressing an often overlooked axis? A. Thyroxine, T4. B. Insulin. C. Cortisol. D. Vasopressin. E. Aldosterone. Answer: C. Cortisol.